Hi, my name is Marian Villalon and I'm here to present marijuana abuse. I I chose marijuana because this is one of the second most abused drug here in the US. Um, Second to alcohol use. Marijuana is also called a weed, an herb, a pat, or a grass, bud, ganja, Mary Jane, and a vast number of other slang terms. This is a greenish-gray mixture of the dried flowers of cannabis sativa. Some people smoke marijuana in hand-rolled cigarettes called joints, in pipes, water pipes, sometimes called bongs, or in blunts. Marijuana rolled in cigar wraps. Marijuana can also be used to brew tea, and particularly when it is sold or consumed for medical purposes. It is frequently mixed into foods such as brownies, cookies, or candies. Vaporizers are also increasingly used to consume marijuana. Stronger forms of marijuana include sensimilla from specifically tended female plants and concentrated resins containing high doses of marijuana's active ingredients, including honey-like hash oil, waxy butter, and hard amber-like shatter. These resins are increasingly popular among those who use them both recreationally and medically. History of abuse. During the 1600s, the marijuana is highly used in clothing, rope, and sails. In 1619, the Virginia Assembly passed legislation requiring that all farmers grow hemp. Some states even traded hemp as legal tender. During the 1700s, George Washington was interested in farming hemp, but he also questioned the potential medicinal use of marijuana in his journals in 1765. 1840, the marijuana became widely accepted in mainstream medicine and was one of the ingredients used in many over-the-counter products. Marijuana was added to the U.S. Pharmacopoeia. It was used as a treatment for opioid withdrawal, pain, appetite, stimulation, and relief of nausea and vomiting. 1862, hashish candy was advertised in an issue of Vanity Fair as a pleasurable and harmless stimulant that could cure melancholy and nervousness. 1906, the Food and Drug Act required that any product containing cannabis be labeled appropriately. During the 1900s and 1930s, for 3 decades, marijuana was an ingredient in a variety of medications. It was marketed as a painkiller but was also used for sedation and to treat muscle spasms. However, during this same time period, Mexican immigrants introduced recreational use of marijuana. Because the drug became associated with the Mexican immigrants, people began to fear the drug, with anti-drug campaigners referring to it as the Mexican menace. 1930, marijuana regulation law was created, wherein the Great Depression resulted in job loss for many Americans. This created more fear and stigmatization of Mexican immigrants, as many Americans worried that they would take away their jobs. This led to more public concern over the dangers of marijuana. The media began to report that research showed that marijuana use was linked to crime and violence. At the same time, Harry Anslinger, commissioner of the Federal Bureau of Narcotics, began a campaign to criminalize marijuana, claiming that it led to insanity. As a result of his efforts, by 1936, all states had some form of marijuana regulation laws. 1936, the film Reaper Madness portrayed marijuana as a drug that could lead to violence. 1937 is when Marijuana Tax Act was passed, which restricted marijuana use to only those that could pay a heavy excise tax for specific authorized industrial and medical use. 1942, marijuana was discredited for medical use. It was removed from the U.S. Pharmacopoeia and doctors began to discredit it. 1944, New York Academy of Medicine published a report stating that marijuana is only mild intoxicant. 1952, the Boggs Act, which creates a strict mandatory punishment for offenses involving marijuana and a variety of other drugs. 1960s, marijuana gained popularity among the counterculture who considered it as a harmless high. It was popular among college students, free-spirited beats, anti-war activists, hippies, and other youths. President John F. Kennedy and Vice President Lyndon Johnson commissioned reports that found that marijuana did not induce violence or led to the use of other more dangerous drugs. 1970s Oregon, Maine, and Alaska decriminalized marijuana. 1972 Schaefer Committee attempted to recommend to decriminalize the personal use of marijuana, but President Nixon ignored the recommendation. 1976 Parents' movement against marijuana began. As more and more parents feared the drug and sought to prevent use in teens, their efforts were strengthened by the Drug Enforcement Administration and the National Institute on Drug Abuse. 1980s and 1990s, marijuana was identified as a gateway drug to cocaine and heroin. 1999, the Clinton administration spent $25 million to advertise the anti-marijuana use. In the year 2000, up to present, marijuana is now legal for recreational and medicinal use in all states in the US. As of 2019, there are 48.2 million people, or about 18% of Americans, use it at least once. According to research, 3 out of 10 people who use marijuana developed marijuana use disorder, especially for those aged below 18. Marijuana use directly affects the brain, specifically the parts of the brain responsible for memory, learning, attention, decision-making, and coordination, the emotion and the reaction time. Infants, children, and teens who still have developing brains are especially susceptible to the adverse effects of marijuana. Long-term frequent marijuana use has been linked to increased risk of psychosis and schizophrenia in some users. Using marijuana during pregnancy may increase the person's risk for pregnancy complications. Pregnant and breastfeeding persons should avoid marijuana. Risk factors. Youth are the ones who are at risk for marijuana use disorder. According to survey, 15% of high school students claim that they have used illicit injection drugs. 14% claimed of misusing prescription opioids. What are the risk factors for this vulnerable population? Number 1 is the family history of substance abuse, favorable parental attitudes towards the behavior, poor parental monitoring, parental substance use, family rejection of sexual orientation or gender identity, association with delinquent or substance using fears, lack of school connectedness, low academic achievement, childhood sexual abuse, and mental health issues. What are the short-term side effects of marijuana? Some of the most common short-term side effects of drug abuse include getting hangovers, withdrawals, feeling a crash, anxiety, panic attacks, being paranoid, hallucinating, getting very irritable, becoming very sad or depressed, and many other short-term effects as well. For the long-term side effects, this marijuana can cause depression, early onset of Alzheimer's disease, schizophrenia, hallucination, being paranoid, stomach issues, lifestyle, personality, and relationship issues. What are the signs of symptoms of abuse upon assessment? During assessment of this person, you will see that their eyes are red, excessive. During interview, you will find out that they are excessively eating outside of regular meal or snack times. They are irresponsible with their responsibilities in school, in home, and at work. They are withdrawing from friends, family, or co-workers. They have problems with concentration and/or memory. Upon checking the vital signs, you will find out that their heart rate is very rapid, above normal. They have dry mouth, they have paranoid thoughts, and they have diminished coordination. Marijuana is found to be independently related to suicide, and the overdose potential is unlikely. What's the care plan for a patient with marijuana abuse? No medications has been approved by the FDA as of today. Although symptoms can be reduced by using some sleeping aids, to help with sleeplessness, such as Ambien or Solfidem. The Buspar can be used for anti-anxiety, the gabapentin, which can help sleep as well, and this is an anti-epileptic medicine. Nutritional supplements such as N-acetylcysteine, which can help in the reduction of withdrawal symptoms. Pharmacological treatments that can be used are a therapy in the form of cognitive behavioral therapy. This is a form of psychotherapy that teaches people strategies to identify and correct problematic behaviors in order to enhance self-control, stop drug use, and address a range of other problems that often co-occur with them. Contingency management. This is a therapeutic management approach based on frequent monitoring of the target behavior and the provision or removal of tangible positive rewards when the target behavior occurs or does not. Motivational enhancement therapy, a systematic form of intervention designed to produce rapid, internally motivated change. The therapy does not attempt to treat the person, but rather mobilize his or her own internal resources for change and engagement in treatment. This person is to be referred to cardiologists due to the potential side effects of marijuana on their heart, and endocrinologists, they may have stomach problems due to the GI effects of these drugs. Also, psychiatrists who deal with their mental health problems, neurologists, and behavioral therapists as well. Addiction starts from trying the substance until the person will want to have more and more. The recreational use of marijuana in the US opened the door to more mental illness, especially to the youth who can be easily influenced by their peers and the environment that they live in. As PMHNP, providing the right education to the patient and the family, as well to the community, is very important.